Hello guys, good evening. Okay, we'll start with today's discussion. Today's why conundrum is like we have a question here, and that is why some suffer from orgasmic headache. Certain words are there. I think most of you would be knowing about the meanings of it. Why some suffer from orgasmic headache. Of course, these two terms, of course, most of you will be knowing about what is this orgasm and what is about headache. So I don't need to explain about that. Of course, you could easily understand it. Patients who develop headache whenever they are landing up in orgasm. This is called as orgasmic headache. This is you'll be having a major query. So is it like a common thing, or is it like very much common, or do I have it, or may I have it? See, the incidence is very much lesser. Less than 1% of the patients might be developing this orgasmic headache. Now, how this has actually been developed, sir? First is the incidence. The second one is how this is actually being developed. This actually develops because whenever a patient is landing up in orgasm, whenever a patient is landing up in orgasm while having sexual activity, and this orgasm will be producing a sudden increase in the blood pressure, the BP tend to rise up. Thereby, there will be a vasodilatation to be happening, primarily in those trigeminal vascular system. In the trigeminal vascular system, there will be an increase in the blood pressure, there will be a vasodilatation. And please have this basic knowledge that erection and migraine both are due to vasodilatation. Erection and migraine both are due to vasodilatation. So here, again, because of vasodilatation which is happening, patients may be landing up in very severe type of headache. Okay, sir. How this headache actually looks like is it going to be very much mild or is it very much severe? This has been named as an explosive headache. Explosive headache, or also it mimics like a thunderclap headache. It mimics like a thunderclap headache. I hope you know what is a thunderclap headache is. Thunderclap headache is very much similar, which is seen with subarachnoid hemorrhage. In subarachnoid hemorrhage, there will be a thunderclap headache, and similarly, that headache would be very much severe. It will be starting for around the duration of the headache would be for around for 1 minute. Some patients have landed up in up to 180 minutes, which means for 3 hours. The headache would be either will be there just for duration of 1 minute, or it might be continuously there for up to 3 hours. This is very much rarer phenomena. But even after that thunderclap headache has been gone, that mild or dull pain will be there for up to a maximum of 72 hours. Mild headache will be continuously seen up to a maximum of 72 hours. So here comes the famous question, the second famous question. So when will the headache exactly start? Is it going to be on the time of orgasm, or before orgasm, or after orgasm? Because if it is after orgasm, no problem at all. So please stop the session, because we're not interested further. But this is not going to be happening there. When the headache is going to be severe, this will be there just before orgasm, or during orgasm also. It will not be happening after the orgasm. So this headache is very much severe. Just imagine a patient is having sex, and just before orgasm, patient is having an explosive thunderclap headache. Thereby, he is not progressing on towards orgasm, and he stops doing this. He stops his sexual activity, and this if the headache is very much severe, we want to treat it. Now comes the famous next famous question: how do we treat this particular case? Okay, if a patient is landing up in this severe type of headache, explosive type of headache, especially during sexual activity, we have to manage this headache due to the sexual activity. How do we treat it? We administer triptans. Triptans are the treatment of choice. Within triptans, we choose zolmitriptan. Zolmitriptan, why? Because it is administered as a nasal spray. This is administered as a nasal spray. Zolmitriptan 5 milligram is given as a nasal spray. This can acutely manage the headache which is developed following sexual activity. What if a patient is not responding, or the patient is having previous history of myocardial infarction? Patient is having a history of myocardial infarction. Patient is not responding, or patient is having a history of myocardial infarction. In those cases, I can replace zolmitriptan with naproxen. Naproxen is an NSAID, non-steroidal anti-inflammatory drug. This can acutely manage the headache which is due to sexual activity. Okay, sir. Now we have managed the headache up to the maximum. As we told, it will be there for up to 72 hours. Okay, how do we prevent this further headaches from occurring? What if I have regular headaches whenever I'm having sexual activity, but what if I can prevent it from happening? Well, here comes the famous question. This is recurrence. How do we prevent a recurrence of this headache, which is called as orgasmic headache? Patients should be under prophylactic therapy, also called as anticipatory pre-treatment. We have a famous terminology, anticipatory pre-treatment of this like orgasmic headache, or simply in our terminologies we can call it as prophylactic therapy. Prophylactic therapy, we can ask the patient to take up indomethacin. Indomethacin is a powerful drug. It can be used to prevent the thunderclap headache to be there during the orgasmic episodes, or we can also opt for propranolol. Propranolol is a non-selective beta blocker. This also can be used to prevent the development of headaches. Or we can opt for triptans. The primary first treatment of choice would be indomethacin. The second treatment of choice would be propranolol. The third treatment of choice would be triptans. Okay, so now we have administered this like indomethacin and the patient is not having a headache. What if the patient has taken this tablet? Even after that, the patient is landing up in severe headache. Then we have to rule out subarachnoid hemorrhage. Very important step, guys. We have to find out what is the differential diagnosis of it. Thunderclap headache, it might be because of a head injury. We have to rule out the presence of subarachnoid hemorrhage, following which we have to find out what might be the reason behind. Whenever subarachnoid hemorrhage has been ruled out, then we have to think about this orgasmic headache. Because the incidence of orgasmic headache is less than 1%, guys. It's not a common one, but a subarachnoid hemorrhage is a very severe one, and there is more common chances that patients might land up in subarachnoid hemorrhage because of a head injury. We have to rule out the acute emergency first, following which we have to start thinking of whether it might be an orgasmic headache. Okay, sir, we have one more question, guys. Which triptan can be used at least 4 hours before sex, right? And that is, we have frovatriptan and naratriptan. These drugs can be given up to 4 hours before sex, because these drugs tend to have a longer duration of action, whereas at the same time, when you administer these drugs, the effect will be there still very long, and we can take the tablet 4 hours before the expected sexes. With this, we finish up today's why conundrum, guys. Why some patients tend to develop headache while during orgasm? Because of trigeminal vascular system leading on to vasodilatation. Why is there a vasodilatation? Because of increased blood pressure, which might be stimulating the trigeminal nervous system, which might be due to orgasm, guys. And which patients would be more prone to develop this? Male patients are more prone to develop this orgasmic headache as compared to female patients. And how do we manage it? Acute headache, treat the patient with zolmitriptan given via nasal spray, or we can opt for sumatriptans also. Patient is not responding, then we can opt for NSAID, non-steroidal anti-inflammatory drugs like naproxen. How do we prevent this symptoms from occurring, guys? How do we prevent this? The treatment of choice is going to be indomethacin. Also, we can opt for propranolol, or we can add triptans. The triptans, which tend to be having a longer duration of action, can be taken at least 4 hours before sex, which is frovatriptan and naratriptan. With this, we finalize today's why conundrum, guys. I hope you have found the answer for this question. We'll meet up in one more interesting session. Good night.